Dear student, now we are going to explain why diastolic pressure rises on assuming standing posture from supine posture. On standing, diastolic blood pressure shows an increase of 5 to 10 mm of mercury, but systolic blood pressure falls. So what happens when a person assumes a standing posture from sitting or supine? You will see that there will be peripheral pooling of blood. So more blood, they will be pooled at the periphery or the inferior extremity, and we know that the veins are highly distensible. So when the blood is pooled into them, they will be distended and they will accommodate the blood into them. So blood tends to pool in the lower leg veins. In the standing posture, there will be peripheral pooling of blood. Now if more blood is pooled peripherally, that means there will be less venous return. So less blood is going back to the right side of the heart. This less blood is going to the pulmonary artery, and less oxygenated blood is coming to the ventricles, left ventricles, and less oxygenated blood is going to the peripheral circulation. So peripheral pooling means low venous return and low cardiac output. From the definition of systolic blood pressure, we know that it is a maximum pressure recorded during systole. Systolic blood pressure actually depends on this cardiac output. If cardiac output is increased, systolic blood pressure is increased. If cardiac output is decreased, systolic blood pressure is decreased. So in the peripheral pooling of blood, when the cardiac output is decreased, so obviously the systolic blood pressure will fall. Now what happens in diastolic blood pressure? From the definition of diastolic blood pressure, we know that it is the minimum pressure recorded during the cardiac cycle. Diastolic blood pressure, on the other hand, it primarily depends on the peripheral resistance. The resistance offered by the peripheral blood vessels. Diastolic blood pressure changes with the alteration in the peripheral resistance. The relationship between the flow in a long narrow tube, the viscosity of the fluid, and the radius of the tube, it is expressed mathematically by the Poiseuille-Hagen formula. It says F is equal to Pa minus Pb divided by R. Here Pa minus Pb is the pressure difference between two ends of the tube, and this R or resistance is expressed by 8 L eta divided by pi r to the power 4. So here it shows that resistance varies inversely with the fourth power of the radius. Fourth power means a small change in the caliber of the vessel will markedly affect the resistance. If the radius is half, then there will be 16 times increase in the resistance. Now, when there is sympathetic stimulation in our body, this sympathetic stimulation, they will cause vasoconstriction, and this vasoconstriction means there is reduction in the radius of the blood vessels, and this reduction, how it will affect the resistance? Resistance will be markedly increased. So when a person, they assumes a standing posture from the sitting posture or the supine posture, we know that there will be peripheral pooling of blood, which will cause less venous return and less cardiac output. So this less cardiac output causes increased sympathetic discharge, and what is the effect of sympathetic discharge? It will cause vasoconstriction. So vasoconstriction means reduction in the radiance, which will increase the peripheral resistance. And which blood pressure? It depends mostly primarily on the peripheral resistance. It is the diastolic blood pressure. So diastolic blood pressure will be increased as a result of this sympathetic vasoconstriction. So it explains why the DBP or diastolic blood pressure rises on assuming standing posture from supine or sitting posture. Thank you for watching. Subscribe the channel. If you want anything special topic on this explain why, you can suggest in the inbox of the video.